WebMD recently completed a survey that said 50% of Americans want marijuana to be legalized. But when it comes to doctors, 67% say it should be a medical option. Joining me now is Dr. Michael Smith. He is the chief medical editor over at WebMD. So, Dr. Smith, it sounds like doctors are really on board with marijuana as a medical treatment, according to your survey.
Yeah, I mean, the WebMD Medscape survey that we recently did shows nationally, about 56% of physicians do support legalization. Really upwards of 60 to 70% of them, though, actually do feel it should be an option because it has real benefits. I mean, there's a big gap there, though. There's a lot more we need to know about medical marijuana before it gets national approval.
And when we look at the AMA, the American Medical Association, then we also look at the National Institute for Drug Abuse, NIDA, we see a conflict there because the AMA is very much against medical marijuana and NIDA is kind of on the fence. They sound like they don't want it, but they're also giving themselves a little wiggle room. Why do we have this kind of conflict?
Well, I mean, NIDA, you can kind of understand. There's certainly marijuana itself does have a high potential for abuse, so you can understand the sensitivity there. And you're right that the AMA doesn't support medical marijuana, but I actually don't think it's as big as a conflict as it may seem, because we're missing a huge piece of the puzzle, and that's the research to back it up.
All right, and that also points us back to the FDA, which on the one hand say it's a Schedule I drug that says it has no medicinal qualities and keeps researchers from being able to do more studies. But then on the other hand, they're also approving drugs like Marinol and then also approving drugs from GW Pharmaceuticals. So it just seems like they've got conflict within themselves.
Yeah, I mean, even with medical or recreational marijuana, you see some differences among different governing bodies in the government. That said, really, physicians themselves, though, really aren't basing it on what the government thinks. To be honest, it's really about what can help patients. And we're generally seeing an accumulation of data that support that. And that's why you see that from the survey. But what we haven't seen is we've addressed medical marijuana so differently than we have any other drug. Most of the times we have research done, the FDA analyzes it, reviews it, and puts their stamp of approval before you see widespread prescriptions. It's gone completely opposite with medical marijuana, state by state, and I think our survey actually shows physicians would prefer the national route. But we recently launched a marijuana special report called Marijuana on Main Street, so a lot of our users are going directly to that special report because not only does it contain the survey results, we have some really heart-wrenching stories, especially kids with epilepsy who are suffering hundreds of seizures every day. Nothing else has helped. They've moved to Colorado. They're trying a special strain of medical marijuana, and their seizures have almost disappeared. So that's why there's so much emotion wrapped up in here, and why a lot of physicians and also consumers are really interested in learning more about it and seeing it where it goes today.
All right. Well, thank you, Dr. Smith. It does seem like it is going to be a grassroots effort rather than the other way around. I'm Deborah Borchardt, and this has been your Pot Hit for the day.